Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxim Eleanor Blum Patient Family Learning Center at Mass General. Before I get started, just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has mute so we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time from the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so joining us today, we have Dr. James McKowen. Dr. McKowen is a clinical psychologist working as clinical director of the MGH Youth and Youth Adult Addiction Program, also known as ARMS, as well as an assistant professor of psychiatry at Harvard Medical School. He is also the co-chair of the MGH Psychiatry, Climate Change, and Mental Health Committee and an associate at the MGH Center for Environment and Health. Dr. McKowen has clinical and research interests in the impacts of climate change on youth, specifically the mental health consequences. He is focused on solutions and interested in nature-based engagement for youth in climate distress. In recognition of Earth Day, which was on Tuesday, he joins us today to give a talk on the mental health impacts of extreme heat driven by climate change. So please join me in welcoming Dr. McKowen.
Thank you so much, Amy, and really wonderful to be here today. And in recognition of Earth Day on Tuesday and Earth Week, it seems like a good time to have a conversation about heat, particularly as we are getting ready for summer here in New England. All right, let me share my screen and we can get going. Hold on 1 second. Okay. I'll get there. I think after all this time, it would be more straightforward. All right. Okay. I appreciate the Blum Center hosting this. I did talk last year on climate change and mental health, so really appreciate being here today to specifically talk about heat and extreme heat. Okay, so I don't have anything to disclose today. So I thought we'd focus on what you need to know, first of all, as we think about the impacts of heat on mental health in particular. Of course, we're going to touch about the impacts of heat on our physical bodies. And then the second part of the talk, I'll discuss the sort of what you can do, sort of solutions from an individual, sort of community and policy level when it comes to thinking about heat and extreme heat. So just to level set, so climate change is defined as a long-term shift in global and local weather patterns caused by carbon emissions. And you can see here at the picture on the right, so the sun radiates the earth and then greenhouse gases trap excess heat and reduce the ability for the planet to lose heat through the atmosphere. And so carbon dioxide is one of the fossil fuel gases. So there's also nitrous oxide and methane are other ones. They differ a little bit in how long they stay in the planet, as well as how much they trap warmth. Methane, particularly in the short term, is a lot worse. And so there's a lot of work to try and manage methane release at the moment. But essentially, that's what's happening. It's sort of a blanket around the planet that's keeping it warmer and warmer. So climate change causes lots of changes in weather patterns, not just heat. We see changes in fluctuations in cold as well. Some of us in New England may remember a polar vortex that happened. That's where Arctic air dips down from the North Pole and reaches lower. Louisiana had snow recently, which is really unusual. That is also caused by shifts in weather patterns associated with changes in carbon dioxide levels. We also know that climate change impacts drought, right, rainfall. Although for every degree of warming, we see a 7% increase in moisture in the atmosphere. That's why we see oddly more rain, but we're seeing more intensive rainstorms, bigger deluges, and larger periods of drought. Of course, we have increasing hurricanes and forest fires, but today we'll talk about heat in particular. So I think to put this in context, often people wonder, well, hasn't the planet always fluctuated in temperature? Hasn't it always ranged? And so the answer to that is yes. But if we look at this picture, we can see now this is global time in a graph. So bear in mind, over on the left, you've got millions of years, to the center around thousands of years, to more recently over here on the right, hundreds and tens of years. So the scale is pretty broad but condensed. And you can see that the planet temperatures have fluctuated, but critically, where we are today, 2025, we haven't seen planet Earth be this warm for over 150,000 years. And so that's relevant because the planet Earth has been very stable. It's really not fluctuated that much in modern times. And by modern times, I mean, hundreds of thousands of years. And so what's concerning about our current temperature pattern is what is projected to be potentially global temperatures by the end of century. So 2100, we're projected to be, depends on the emissions targets and how they're reached, but anywhere between 3 to 4 degrees potentially. And so the last time we were at that temperature was 15 million years ago. And so that is quite a significant change. What's particularly relevant is the pace at which change has happened. So remember, these fluctuations you can see are over hundreds of thousands, even millions of years. Our temperature change has really been over the last couple of hundred years, right? Post-industrial revolution. And so that rapidness of change is what's concerning our ability to adapt, animals and plants to adapt, and is causing kind of these quick changes that we're seeing. The connection between greenhouse gases and temperature is pretty clear. This is looking at data from NOAA back in the mid 1800s, so sort of the very beginnings of the Industrial Revolution. You can see over time as the line of CO2 gas have increased, you can see the average warming has also increased. So there's a pretty clear correlation here between greenhouse gas release and our global temperatures. We also notice that the ocean surface temperature is dramatically increasing as well. So this is average data from 82 to 2024. So you can see for the most part, it's within a relative band of blue. The yellow line is 2023, and then the red line was the beginning of 2024. And so we know that the oceans have absorbed 90, oops, lost my slides. There we go. Have absorbed 91% of excess heat. So they've been doing a lot of the work here. And there's some studies to suggest that if the oceans weren't absorbing this much energy, our current planetary temperatures would be 122 degrees Fahrenheit. And just to put it in context, the ocean absorbs about 5 H-bombs worth of energy every second. And so that's really significant. Most of our heat has entered the oceans. We're seeing ocean temperatures increasing as well as ocean acidification, which is concerning for marine life. So the last 10 hottest years in the US, now focusing on us here, have really been, 2024 was the hottest year on record so far, but you can see in the last 10 hottest years have been in the 2020s and early 2020s and late 1998 down here. And our last year was the first year that the average global temperature exceeded 1.5 degrees centigrade. Now, you've heard 1.5 degrees probably a lot. It's part of the Paris Accord agreements. It was a global target to keep warming to 1.5 degrees. That is an average over about a decade. And so we haven't exceeded that yet. But the fact that last year was an average global temperature of 1.62 degrees centigrade suggests we're not really on target to maintain and meet the Paris Accord agreements for keeping global temperatures at that level. That number is significant. That is the temperature that probably we can manage, but projected temperatures of 3 or 3.5 degrees would result in massive planetary changes in weather patterns, food, and droughts and fires and things like that. So We really have to work hard to try and bend that curve. The good news is it was projected to be 4 degrees, but there have been a lot of changes lately. And so that projection has gone down a lot to 2.6 to 2.9 degrees by end of century, which is good news. So I'm always talking about hope and thinking about not all doom and gloom. And so that I think has really been a recent change that's for the better for sure. In the US specifically, by 2050, these are sort of places that are expected to see more extreme changes in temperature. And so you might think, well, yes, the Southwest or even Florida, but actually New England, northern the US, Minneapolis, that kind of area, are expected to see pretty big swings in temperature. And so sometimes we think in New England we're kind of immune to climate change. We haven't had a lot of changes, but I think that's a false sense of security. Climate change is definitely happening, and we're poised to get some more changes in our temperature maybe than other parts of the US. In Boston specifically, which is where I am today and giving this talk from, in the last decade, we've seen more hot days and importantly, hot nights. So hot nights are really relevant here for the body's ability to adapt to temperature. So, if you go about during the day, you can get shade and your body gets really exhausted from managing heat. And then at nighttime, it cools, and that's your body's ability to re-energize and come back to baseline. But when nights are hot, particularly if you don't have air conditioning, it can be really hard to adapt. And so heat at night is particularly concerning when we think about changes in extreme heat. This graph gives us a sense of where Massachusetts might be end of century, and you can see as it drifts down towards South Carolina, Florida, these are sort of scenarios in which case we may or may not meet our Paris Accord agreements or these other global temperature targets. So it gives us a sense of where weather might be like. Now, certainly in New England, it's freezing here in the winter, and you might think, oh, that's kind of nice. I'd like to have it be as warm as South Carolina, but I think the challenge with that is that the rapidity with which that change has happened will leave adaptation really difficult for plants and animals as well as humans. Not a lot of us in New England or even the northern US have the same degree of sort of infrastructure like air conditioning like these warmer states do, like Texas or Louisiana or even Arizona. And so adaptation might be much more expensive and challenging for us. Importantly, the reason we talk about heat is because it's sort of like the unknown or the not well understood climatic event. We're all familiar with hurricanes and floods and tornadoes, but heat actually causes the most fatalities of any kind of climate-related disaster. They don't have them named like we see hurricanes. We have Irma or Andrew. These are sort of named storms. There has been discussion to name heat waves because it brings people's attention and focus to this, but unfortunately, heat is causes the majority of mortality and morbidity related to climate-related events. So, as a clinician working with patients, it's really important for us to understand the impact of heat on psychiatric illness in particular, as well as other health issues. So how does that stack up compared to other physical illnesses we may have? This is data from Arizona. This was from 2023. So Arizona is obviously a hot state, but it was interesting that they gathered data on cause of death, and heat-related deaths were right square in the middle, right? More people died from heat-related events than influenza, than COVID, than suicide. It's also likely slightly underreported when someone comes into the emergency room for a cardiac event and they pass away from that, it's documented as, a cardiac arrest or heart disease, but it actually might have been brought on by extreme heat. So likely these numbers are a little bit lower, and there might be cause for other issues, same with strokes or other issues. So it's not really, we're not 100% sure if this is accurate, but it does allow us to see that compared to relative other illnesses, heat is definitely really relevant here to our own physical cause of death. So obviously people know about sweating. That is how the body cools, right? We release water vapor through our skin, and with wind and breeze, that causes evaporative cooling, and that allows our body to lose the heat inside of us. And so sweating is very important as your body's way to cool, as well as when we breathe out vapor as well. That can sometimes help us cool our body. But importantly, how your body cools is really dependent on the environment in which you're in. So this graph allows us to understand two different types of temperature. One is called dry bulb and one is called wet bulb. So essentially, wet bulb temperature is literally a thermometer with a wet rag around the bottom. And then when the wind or a breeze hits that wet rag, it cools down through evaporation. And so this is relevant to humans, right? Because when we sweat, we lose heat more efficiently, right? But that depends a little bit on humidity. So if we live in a very humid climate or a humid area, your body's ability to cool reduces. So relative humidity here on the left against temperature here on the bottom in centigrade and Fahrenheit. So when humidity is low, we can tolerate much higher temperatures of heat. But as humidity rises, we see that your body's ability to cool reduces. And so with high temperature plus high humidity is particularly dangerous. And so we see when wet bulb temperatures exceed certain thresholds, it becomes really difficult for the body to cool itself. Relevant here because, as I mentioned earlier on, we're seeing every degree temperature rise in Earth's temperature. We see increased humidity in the atmosphere, and so we might start to see areas that are less humid become more humid. And particularly during heat waves, that's really relevant. So looking at index temperature to tell us what the actual temperature is calculates in humidity. So that's particularly important to be paying attention to how humid is. If you've ever been to the South or you're from the South, you know what humidity is. You've experienced it and you know it's really hard to cool down. But northern states, less humid, but that is starting to shift as well. So the body's response to heat varies a lot. We can have impacts on cardiovascular stress. We can have skin exposure, obviously, to UV, can cause sunburn and sun rash. Dehydration is really important. We can get heat exhaustion and heat stroke, which I'll talk about in a moment. We know that heat can impact our immune system's response and actually exacerbate inflammation. So folks with comorbid medical issues or elderly, and I'll talk a moment about who's at risk for heat, you can understand that as the body gets hotter and hotter, it can really exacerbate pre-existing medical issues, including heart disease or kidney issues or other immuno issues that we might see. So heat exhaustion and heat stroke are really important to know. Part of educating about extreme heat is understanding what the warning signs are that you're struggling. So heat exhaustion is sort of the precursor if we don't intervene to heat stroke. So you might experience dizziness, thirst, you might feel thirsty, sweating a lot, you actually might get a little nauseous. You might feel clammy skin and you might get muscle cramps. Like that, these are warning signs that you really need to pay attention to. If untreated, this can lead to heat stroke, which is really a medical emergency. And we might not think of it like that, but when someone has experienced the symptoms of heat stroke, we do have to call 911. They can get confused, they can faint, their body temperature is highly elevated, they have red hot skin. They actually can't sweat, so that their skin might feel kind of dry and they have a strong rapid pulse. And so that's when we're reaching a real danger space where someone can actually pass away from excess heat. So if you notice some of these symptoms occurring, we really want to be paying attention and getting emergency help right away. So, who is most at risk for extreme heat? This is particularly relevant as a clinician. I work with very different types of people. We know that older adults are particularly vulnerable. We know their bodies are not as effective at cooling themselves down. They sweat less. Children are particularly vulnerable. They obviously don't have awareness to heat. Their ability to regulate and sweat is different as well. They have different types of fat in their body. So children are particularly vulnerable. They also, don't have a good sense of running around and I'm too hot. So kids playing sports outside in the summer, high school kids, latency age kids who are running around all the time in the summer, they got to be careful about those populations. and being exposed to heat. And especially high school sports kids, they can push themselves a lot, and that can be pretty concerning in terms of their vulnerability. As I mentioned, folks with medical conditions are particularly vulnerable. That includes mental health, which I'll talk about. Folks without air conditioning. So fans work, except when temperatures reach around 90 degrees Fahrenheit. Once we're at that level, fans don't really do that much. And so we're really looking at including maybe a spraying in there to get some moisture over a bowl of ice, or even better yet, switching to air conditioning. People who are unhoused, I work with folks with addiction, many of whom are homeless, so highly susceptible to the extreme heat. And also pregnant people are particularly vulnerable, right? Obviously, you're carrying a baby, and so your ability to regulate heat is impaired as well. And then outdoor workers, another particularly vulnerable group. And people who are outside, builders, construction, are very vulnerable to extreme heats. And then certain racial and ethnic groups are more vulnerable. We know that minority populations, people who are Black, Brown, Indigenous, tend to have more exposure to extreme heat, and environments in which they're in are less cooling with green space and other issues, which I can also talk about. So certain people are much more at risk. So knowing who is in your community, in your family, or maybe you may be someone who is into one of these risk groups as well. So focusing more specifically on our mental health, as a clinical psychologist, I work with people with mental health struggles every day. And so we want to be aware of the risks for people with mental health. And so we know that temperature and mental health correlates with violent crime. Data from Nature in 2017 showed that for every 1 degree rise in temperature, we see a 1.7 increase in violent crime. Violent crime being defined as assault, domestic violence, homicide, or other civil unrest situations. So we know that heat can impact our aggression response. Some data suggests that as certain people who are prone to aggression experience increase in heat, they actually perceive people as more threatening. So it can actually affect our perception of someone who you might see as more hostile, which is exacerbated by heat. Some data in 2019 showed there's this pretty strong correlation between temperature and emergency room visits for mental illness. This is defined by what's called ICD-10 codes, which is a medical code to classify a type of mental illness. And so as you can see with the trend rising as temperature rising, we can see that emergency room visits also are correlated with increasing temperatures. Seems to shift around a 70-degree Fahrenheit range and above is where you start to see challenges with mental health. And then other types of risk groups. So we know that suicide attempts, as well as completion of suicide, also changes with temperature. Some data from 2019 showed that strong correlation. Folks who might have bipolar disorder or struggle from types of mania, there's a seasonal pattern to mania. Some of that can be to do with light and changes in sleep patterns, but we've also got pretty decent data showing that during temperatures in the summer months, we see people experiencing more types of symptoms associated with bipolar disorder. Post-traumatic stress disorder symptoms can also be exacerbated during summer months and higher temperatures. This isn't being diagnosed with PTSD, it is experiencing elevated symptoms, and as well as admissions for post-traumatic stress to medical facilities or mental health issues. Not included in these slides is people with psychosis also have high rates of symptoms of psychiatric distress and psychosis symptoms in the context of heat and temperature. And then also we see people who have a sleep disorder, right? It's not surprisingly, as I mentioned earlier, sleep and nighttime temperatures can really affect our mental health vulnerability. I'm certainly cranky if I haven't slept very well, if it's hot. And so you can imagine if you have an insomnia or other type of sleep disorder, that higher temperatures can really exacerbate the presentation of symptoms. So there's many different ways in which temperature changes impact our mental health risk and vulnerability. This is really interesting data that came out of Boston, actually. A colleague of mine, Dr. Nori Sama, she published in 2022 a really interesting study, gathered data nationally for about 9 years, looking at emergency room admissions in the context of mental health diagnoses. So it's a busy slide, but what I want you to pay attention to is almost for every mental health category, as temperature increased, we see increasing admissions. Now, this was looking at folks who had public insurance, so like Mass Health, Medicare, Medicaid. This was not private insurance, so looking at admissions to emergency rooms. So folks with substance use disorders, anxiety, mood disorders, self-harm behaviors, childhood behavior disruption also increases with temperatures. Interestingly, they found that the folks who live in the northern parts of the US, so, the Boston area, Minnesota, Minneapolis, Chicago, we had higher rates of emissions in the context of heat, which on the one hand you might think is strange because generally we don't experience a lot of heat, but that's exactly the issue. It was around we're not used to that degree of heat, so maybe we don't cope with it as well. And as I mentioned earlier, we don't have as much access to air conditioning or cooling options. We're just not as familiar with navigating extreme heat. And so people in the northern parts of the US may be more vulnerable if you have a mental health issue in the context of high temperature for having a kind of a mental health crisis. So how does temperature impact people with mental health? So we're going to talk about three different spots. We're going to talk about thermoregulation, which is our body's ability to regulate itself. We're going to talk about the role of medications, because these are really important, and then the role of neurotransmitters as well. So these three groups, we're going to talk about why folks with mental illness may be particularly vulnerable to temperature issues. So first of all, when we look at people with depression, we know that they have differences in how their skin sweats, what's called their skin conductance. And so people who are experiencing depression, maybe on a depression medication, also relative to controls have a higher baseline body temperature. We're not exactly sure why that is true, but as I talk about neurotransmitters a little bit, that might become more clear. But essentially, if you're someone who struggles with depression or has an active depression in the summertime, it's really particularly important for you to be paying attention to your ability to cool and how exposed you are to heat. We also see this in folks with schizophrenia, as I mentioned, tend to have lower baseline body temperatures. This is before they get prescribed certain types of medications, which is relevant. And they also, unfortunately, have an more impaired ability to cool during heat stress. Some of that is due to folks with schizophrenia can, on average, be more overweight and high rates of obesity. And of course, if you have high rates of obesity or your BMI is higher, you have a ratio of ability, your skin to mass is different, and so it's much harder for your body to cool if you happen to be more overweight. And so folks with schizophrenia can be vulnerable in that space as well. I work with people with addiction and substance use disorders, so we know that taking certain substances change our ability to regulate heat. Certain medications, certain drugs rather, like cocaine or ecstasy, amphetamines, increase sweating, increase our core temperature. And so that can be particularly challenging if you're using these substances in the summer. It may be hot already, but using these substances increases your body's temperature, and then your ability to regulate and cool may be more impaired. It also might impair your judgment, and paying attention to your body's warning signs may also change with substance use disorders. Alcohol, opiates, and benzos, more the downers, can reduce our response to temperature, and so we may sweat less in these contexts. And so really, people with substance use disorders are quite vulnerable to temperature. Also, we see high rates of being unhoused or outdoors a lot, right? If you're trying to obtain substances, you may be in certain areas in downtown or certain other areas that tend to be exposed to the sun. You might be outside for a long time. You might be unhoused. If you live in a sober house, you have to be out during the day and you can't come in until 6 p.m. And so folks are particularly vulnerable to the effects of extreme heat if you have a substance use disorder and addiction. And then lastly, patients with cognitive issues. This includes the elderly with Alzheimer's, dementia, as well as people with ADHD. We know that higher temperatures exacerbate attention issues, memory, and confusion. And so those are some other folks that are particularly vulnerable to the impacts of heat on our cognitive functioning as well. So kids do less well in school when it's hot, unsurprisingly. It's harder to focus, pay attention. Elderly people get more confused and struggle with the judgment when they may be exposed to more extreme heat. So medications, this is something that not a lot of people are aware of, that extreme temperatures can really impact the efficacy of our ability to regulate our temperature. So SSRIs, so these are selective serotonin reuptake inhibitors, so things like Prozac, They increase our sweating. So if you've ever been on this medication, you know there's some side effects, and one of those is increased sweating. So that's relevant. You think, well, that might make me cooler, but the problem is it can lead to dehydration, right? So drinking and taking fluids is really critical in heat because that is what allows your body to sweat. But if you have a baseline increased sweating rate, it may be that you get dehydrated more quickly and your ability to regulate your temperature is changed. Same with what are called tricyclic antidepressants. Those are also increased sweating. And then other psychiatric medications like anticholinergics, antipsychotics, antihistamines, which can be used in ADHD or anxiety. Antipsychotics can be used to treat bipolar disorder or schizophrenia. They decrease your sweating, right? So that's relevant if you're on these medicines because that might mean again, your ability to regulate your own body temperature decreases because you're sweating less. So if you're on these medications, really important to know about this and talk to your physician, which I'll talk about later about what to do about these issues. But really important to think about medications that you might be taking and how they impact our ability to regulate temperature. So as I mentioned, certain neurotransmitters, this is a bit of a sciencey slide, but certain neurotransmitters, right, those are involved in our memory, they're involved in emotion regulation, they're involved in attention and energy and various different things, anxiety management, all relevant to mental illness, right? Sometimes we have low levels of serotonin in depression. We might have GABA impacts our ability to calm ourselves and anxiety. And so we know that temperature changes some of the efficacy of these neurotransmitters. So serotonin is involved in actually heat dissipation. So if those are shifted, we might have different ability to regulate temperature. That's why SSRIs can be relevant here. Norepinephrine and epinephrine, they're also involved in vasoconstriction. So that's your veins shrinking or expanding depending on temperature. So these neurotransmitters are involved in thermoregulation at baseline. And so when these are adjusted by medication or the external temperature, these may become particularly relevant to be thinking about overall. GABA, which is involved in anxiety, those are actually involved in vasodilation as well, and actually involved in cooling, and glutamate also. So people with mental health issues may have different types of neurotransmitters that work as well. They may have different amounts of neurotransmitters that are secreted during certain times. Medications affect secretion of neurotransmitters, and those neurotransmitters themselves are involved in thermoregulation. And so we can see why people with mental health issues may be particularly vulnerable in the context of extreme heat. Importantly, we have to talk about social determinants of health. So those are larger vulnerability factors, mostly outside of our control, that exacerbate our vulnerability to certain climate events. So if you're a child, as I mentioned, if you're unhoused or you don't have AC, these are bigger social structures that increase our vulnerability to the effects of heat. If we're not well educated about heat, that's a factor. If we're isolated, that can mean that we're more vulnerable to heat events because we don't share symptoms with other people, no one's observing us, social support is lower. If you live in poverty, you're less likely to afford to turn on that AC unit, and you may live in more dense housing with less access to cooling centers. So all these bigger factors can also impact our vulnerability to heat. And we know people with mental health issues can experience many of these different social determinants of health. As I mentioned earlier, certain racial and ethnicity groups are more vulnerable to the impacts of extreme heat. And we know that certain communities have less access to healthcare services, physicians, emergency rooms, as well as psychiatric services. And so we know that these larger vulnerability factors are also really relevant to know and understand, particularly thinking about if you're a clinician. So what is my patient experiencing? Are they unhoused? Are they someone of a minority group? Do they live in a community that does not have access to AC as much or cooling centers? These things are really important to be thinking about. Okay, so shifting gears to talk about how to prepare for extreme heat. So certainly number one is stay informed. There's a lot of different ways in which you can stay informed from the local weather alerts. You may remember this was a screenshot taken from June of last year in Boston when we experienced some pretty decent heat waves. And so the media as well as the government give us heat advisories, heat watches, and heat warnings. And so these are some things to be paying attention to. And they shift in severity depending on how hot things are. You can set your phone, your Android or your iPhone to give you a weather alert, an extreme weather warning in your area. We tend to know ahead of time when heat waves are coming, just like we do with hurricanes. We usually have a week, 10 days or so to have a sense of that they're on their way. And so we can, in that context, prepare for these extreme weather events. Heat.gov is another good resource. So really staying informed is number one to know when we might be experiencing an impending heat wave. My colleagues at the MGH, a great group of clinicians, provided some education, right? Staying informed of patients with schizophrenia. This is Dr. Carol Lim and Oliver Freudenreich, and other colleagues here developed a handout to help people with mental health issues with schizophrenia know about heat, understand their vulnerability. They also did some education to providers. They did a heat education session. They went to certain clinics in the Boston area that provide care to patients with schizophrenia. And then they went out to different shelters, to inpatient units, to group homes to provide education around heat, particularly how to stay cool, the role of your medications, know the warning signs. So staying informed and education of patients is particularly critical. So if you have a family member with a mental health issue, this would be important information to share with them, understanding that they're a more vulnerable person as well. So this was really great program that was done here out of Mass General to support patients with schizophrenia. And we're probably going to be copying this and starting to educate other patients as well, particularly people who are unhoused or people with addiction. Some other work out of MGH, Dr. Haynes in 2022 did some work with communities in the CREW program, which is communities responding to extreme weather. She did some extreme heat workshops to educate specific communities in Boston, specifically Dorchester, Mattapan, particularly areas that are more vulnerable to extreme heat. And they provided heat relief kits, including ACs and fans, to certain populations. So this is part of our plan to try and educate the population and raise awareness and have people stay informed. So this is a really successful program that happened in 2022. So thinking about yourself or a loved one or someone you know with a mental health issue or any other medical issue for that matter, it can be helpful to make a heat action plan. This can be done with your family, with your doctor. You want to, first of all, stay cool, right? So try and stay in the shade, seems obvious. Use a fan. Again, I said there's limitations to the use of fans around 90 degrees Fahrenheit. They start to not be super effective. AC units if possible. Of course, that varies on your income level. Keeping hydrated, critical to sweating. If you're not hydrated, your body stops being able to produce sweat and cooling stops. Know the symptoms. As I mentioned earlier, the symptoms of heat exhaustion, heat stroke, that's particularly important. Headaches, tiredness, weakness. Check your air temperature and your air quality. So we know that some populations, those that have asthma or other breathing issues, if the air quality is poor and there's higher pollution or ozone in that day, and it's hot, they're going to be much more vulnerable to having heat-related symptoms. So definitely be looking at what the pollution levels of your air quality. There's a part of your phone app where you can access that online to see what your air quality index is like. If you take a medication, just know that the certain medications can be impacted by extreme temperatures. Definitely have a plan with your medication. Keep your medication cool if possible. Certainly they can break down in their efficacy if they get too hot, if they're in direct sun or in a hot window or places like that. They may become less effective. And so that's an important thing to be thinking about. And then certain places are vulnerable to power outages in the context of heat. We've seen that in Texas as well as other places. When energy demand goes up, we all turn on our AC units. It can overload the system and we can have blackouts. And so those can be challenging to prepare for, but certainly thinking about if there's a heat wave coming, charge your devices. If you're lucky enough to have a battery or solar power, you may be in a better space, but just thinking a little bit about having a cooler on hand or access to other issues if you know there's a heat wave coming. Sleeping is particularly relevant, as I mentioned earlier, right? Folks with mental health issues have higher sleep disruption. Certainly, people with depression can sleep a lot. Sometimes they can sleep little. People with bipolar disorder can have disruption in sleep. People without mental health issues, we can also have insomnia or slight difficulty sleeping. But certainly when nighttime temperatures are high, it can affect our mood the next day, our ability to sleep. And so thinking about keeping your room, this is in centigrade, so it may not be super understandable for folks who are familiar with Fahrenheit, but around 65 to 68 degrees Fahrenheit is associated with good rest. It's actually good for our rooms to be cold as we sleep. We get more restorative, restful sleep if we are sleeping in a cold room. We want to be taking things like cool showers before we go to bed, not a cold shower. If we take a cold shower, that can drop our body temperature too much, and our body tries to compensate and may actually raise our body temperature. And so we don't want to be having a cold shower. We want a cool, lukewarm shower. Fans and AC are helpful, obviously. AC is tricky, it uses more energy. That might be something that's, if you have less income, that can be a challenging thing to think about. But water sprays and mists can be helpful. Hydration, loose clothing, right? Loose clothing is important because it allows your body to sweat and for that sweat to leave your body. If you wear tight clothing, it tends to prevent your body being able to cool itself through sweating. And at nighttime, that's particularly important to have loose fitting clothing or even sleeping with as little clothing as possible. Get rid of the winter blanket, have a light sheet, that kind of thing, and avoiding alcohol and substances that can also impact your regulation of sleep. And then if you struggle with sleep, trying to have a routine. If you can't sleep, get out of bed, go to a cool part of the house. Maybe you have a basement. Sometimes people sleep down there. They may be able to keep the shades closed during the day to keep their room temperatures cool. So there's other strategies you can use. In terms of the community, it's important to be thinking about where you live. What is my community's heat plan? Is there a heat plan? You can certainly talk to your city. Boston has a heat action plan, Cambridge does, and a couple of communities too. But you can get involved in looking at what's my town's heat action plan. Where are the cooling centers? Are there any energy efficiency programs? What are greening initiatives? Are they planting trees? And which is important, as I'll talk about in a minute. Where are the splash parks? Like what is in my community? How can I get involved? What are the options for heat relief during a heat wave? How vulnerable is my community to heat? You can look at heat.gov and other places to see exactly by zip code how vulnerable your particular community might be. So definitely being involved in what's going on around you is really important when we think about heat waves. Heat island effects you may be familiar with. This is essentially that the amount of heat that we experience varies depending on our neighborhood, mostly exacerbated by concrete, buildings, and tree coverage. So rural areas tend to be, quite significantly 10 degrees sometimes cooler than a downtown area. Certain areas that have historically been redlined through racial practices have fewer access to parks, fewer trees. And so we know certain places and neighborhoods are more impacted by heat. So think about where you work, where you live. Am I in a heat island? What can I do about that? Can I get involved in addressing that issue and trying to get that to change? So green space here, so tree coverage is really important. So this is a street without trees compared to a street with trees, right? So the air temperature can be 104 degrees versus 90 degrees. 90 degrees is still hot, but much different than 104. And then the tarmac or the sidewalk area might be quite different, exposed to the heat. It can be 115 degrees Fahrenheit without trees and 93 Fahrenheit with trees. And so really being involved in green space coverage is really, really critical. We also know that green space is really good for our mental health broadly. So people with mental health issues, being in parks, walking in nature, trying to be in a garden or a community can reduce our stress, generally improve our mental health broadly. And we know that's true for children as well. We see kids who are exposed to green space have better attention overall, better self-confidence. So green space both improves our heat island effects, but also improves mental health issues. And folks with depression who do nature walks have been shown to have lower symptoms, reducing anxiety episodes, panic attacks, if you're able to be out in nature and green space. That doesn't mean Yosemite or, going to a forest every time. It can be in an urban park. It can be near a lake in your community, and even in your garden can be a space where you can have improvements. I've been lucky to work with a Cambridge organization called Canopy Crew, where they have young people plant trees in the community to improve the tree coverage as well as the mental health of residents. So there's things you can get involved in and action you can take in your community to improve tree coverage. Boston has a cooling action plan, so this might be something you can look into depending on your neighborhood. You can find out where you can access cooling centers, where are there pools, where is the green spaces. The red pinky color here shows communities that are more exposed to temperature and less access to cooling. So you can see for those who are familiar with the Boston neighborhood and socioeconomic demographics, you can see that Boston, Mattapan, Dorchester, those sorts of places may be more exposed to heat effects. And so if you live in those communities, you might want to be talking to your city councilors about addressing these vulnerabilities to heat effects. And then two last slides is just what Boston Medical Center is doing, which is super cool. They put a bunch of solar panels on their roof, and they did a pilot program where they provided low-income communities with energy credits generated from the solar on their roof. So this was sort of a prescription, literally by a doctor, if you're involved in their complex care management program. So folks with mental health issues were more likely to be involved in their care management program, needing more social support services, and so obviously may have less income and therefore higher bills or might not be able to afford to turn on that AC. And so this was a cool pilot program that provided certain patients who are Eversource customers, which is our local energy provider, with credits for their electricity bills based on solar power. So this is a really cool policy that the BMC was doing, and OMGH has solar panels that they installed. And so these are some things to be thinking about and maybe getting involved in advocating more for. And then lastly, here at the hospital, we have developed a climate mental health initiative that I'm part of. Our goals are to educate patients and staff. We want to provide clinical resources for disaster preparedness as well as population level prevention. And then we want to increase our research and our understanding of the phenomenon of various different climate related events and heat in particular. There's still a lot we don't know about the impacts of heat on neuropsychiatric issues. And so we definitely have a lot of work to do, but I know that MGB and MGH is really focused on addressing these particular issues. All right, that's everything. Just to summarize, so we know that the number of hot days are increasing, and this is due to heat trapping gases. We know that heat is the biggest cause of climate-related mortality, and that certain patients, people, and populations are much more vulnerable than others, particularly those with mental health issues, as I mentioned. And it's important to have a heat plan, strategize how to prepare and respond to coming heat waves, know your risk and vulnerability factors, and then what can you do at an individual level, community, and policy level to get sorts of things to change? Education, talking to your city, talking to your doctor. These are important things to be thinking about when we talk about heat and mental health. I really appreciate everyone's time and attention today. If you have questions, you can certainly reach out to me directly. Here's my email and contact information. But certainly we have time for questions, Amy, if you want to switch gears and talk about that. But thank you everyone for your attention today.
Thank you, Dr. McKowen. We are now at the end of the session. If you have any questions, feel free to enter them in the chat. We have a question regarding climate change. Is it reversible in today's time?
It's climate change is happening. It's not reversible currently. We are on a better trajectory than we were. So there's been a lot of things to shift in terms of emissions reductions, increasing clean power. So we've bent the curve for sure. But as of right now, it doesn't look like it's reversible to go back to pre-industrialized levels of temperature and CO2 gas, unfortunately.
And you provide some great tips. Do you have anything else you'd like to add on regarding what we can do on our part to lower the average global temperature?
That's a really important question. I think there's certainly things you can do as an individual, right? So things like things I can do to reduce my carbon footprint or greenhouse gas emissions. Things like switching to a plant-based diet or eating less meat as best as you can, flying less. If you can afford an EV, certainly get one of those. If you have the ability to install solar, right? These are all things that can reduce your own carbon emissions. Generally, though, this is a systemic wide global problem, much bigger than any one individual can address. And so I say certainly there's merit to address individual behaviors. I do it myself, but I also know that it's not my fault. I'm sort of in the context of a larger systemic problem. And so voting for climate-friendly policies are important. If you are prone to activism in all its different forms, that could be attending a climate protest, it could be educating people, it could be using art as a communication tool, raising awareness are really important. But know that a lot of these issues are really much broader than any one individual can address. So it is important to kind of balance um, that understanding of climate change and what we can do about it.
Thank you. You talked a little bit about heat stroke earlier on. Why doesn't a person sweat during heat stroke?
Um, Likely they have sweat so much on the run up to getting heat stroke that they become dehydrated. And so their body can't really lose more water. And part of that issue has led them to become even more dehydrated, which has really put a lot of stress on their body. And then it moves them into from heat exhaustion to heat stroke as they can no longer cool themselves and their body temperature raises so much. So that's likely what's happened.
Can you share a little bit more about how children are more vulnerable to impacts of extreme heat?
Yeah, so kids are more vulnerable because they are just, smaller individuals literally physically. And so they may also be much more active and running around. They have different ways in which they sweat compared to other people. Younger children, particularly babies, have, a lot of different types of fat on their body, more fat. And so that affects our ability to cool ourselves as well. As kids are outside a bit more than adults typically, running around in the summer, and so they're more vulnerable from exposure as well. They wear less sunscreen, a parent might forget, they rub it off. So all these different ways in which kids can be more vulnerable to extreme heat. And then I'd say one other thing was they don't sometimes don't share as much that they're struggling or in distress or feeling symptoms, right? As adults, we're much more educated, whereas kids don't really, may not know that they're getting really hot until it's quite later in that process. So they can have difficulty kind of sharing what's going on for them.
Thank you. You had shared some great examples of what Mass General is doing regarding heat education. Where can one go to learn more about upcoming events?
Um, in terms of events at Mass General,
Yeah.
yeah, generally you can reach out to me. We're still developing our early phase of a website for the Climate Mental Health Initiative, which will be our portal for providing education on climate events. The Center for Environment and Health is a Mass General as well. And maybe Amy, we can share their website later. They're doing a lot of work to provide education as well as looking at kind of the infrastructure of the hospital and how to reduce greenhouse gas. They do a lot of public facing talks. So the Center for Environment and Health is another great resource. And then there's other kind of more kind of national organizations. Um, the Climate Psychology Alliance is an example of one. The Climate Psychiatry Alliance, if you're interested in mental health in particular. Um, so yeah, those are some good ways to stay informed about climate events. Climate Mental Health Network is another great organization to keep yourself informed regarding mental health and climate change.
Thank you. You briefly touched upon this, but for those who are not as familiar, can you talk a little bit more on cooling centers and where one can go to search for a cooling center by them?
Yeah, cooling centers, I think they're really important, especially communities where you may not have at home AC. The challenge with cooling centers is that just like this question asked, like, where are they? And sometimes they can be a 20-minute walk from your house, or they can be a bus ride from your house. So you walk in the heat, you get on a hot bus. So they're challenging. I think I can send a link, Amy, maybe we can distribute that later. But Boston, I had it in my slide, I'm forgetting off the top of my head now. The Boston Heat and Climate Change Initiative has access to cooling centers and maps and locations as to where they are. Um, So on the one hand, they're good. The other thing to think about is non-traditional cooling centers. So libraries are particularly great locations to cool in the heat. They tend to have air conditioning on. They tend to be big buildings which are cool. Churches, there may be a church in your community. Churches often are quite big buildings, and they sometimes don't have a ton of windows, and so practically they can be cool spaces as well. Shopping malls, other places you can think of that may be close to your home that may be cooler that you can go to in a heat wave. So there's some non-traditional places to think of as well. Cooling centers may be just less available in your community, and can be sometimes hard to get to. But those are some of the locations to think about during extreme heat waves, when it might be particularly hot. Those can be some spaces to go. A local park, as I mentioned, is going to be cooler than your street. So if you have access to that, near the water can be helpful, to help with that evaporative cooling.
Thank you. And for anyone who's interested in any of the resources that was shared today, I just included our Blum Center email in the chat. It's pflc@partners.org. It essentially stands for Patient Family Learning Center. Feel free to get in touch with us and we'd be happy to share those links with you. This session is also being recorded, so if you'd like, you can also view the recording. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Let me see. I don't believe there are any more questions in the chat. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
I really appreciate everyone's time and attention today. This is not to make you fearful or anxious about extreme heat. It's just a portal to have this discussion, raise awareness, and know that there are a lot of people working on this issue. There are solutions for you as an individual. And so I just want to share that I have a lot of hope in this situation, and it's really important to me to provide education to vulnerable populations. So thank you for everyone's time and attention. And thank you, Amy, for helping organize this.
Thank you so much, everyone. I think that wraps up for the day. Thank you all. Take care.